Well, from allergies to keeping your teeth healthy, identifying cavities is an important step in cleaning the mouth. That's why there are many methods to do so, including a laser procedure. And with me right now is Dr. Christy Leedy from Abilene Dental. Dr. Christy, it's been a while.
I know. Good to see you.
Every time I see you, I feel like I say that all the time. It's been a while. All right, let's talk about what we do have here, a laser cavity detection.
Oh, I love this.
Okay.
Okay, so everyone knows about the dreaded pick.
Dreaded is a key
It's what my
word.
patients are always calling it. Dentists, we call it an explorer,
Okay.
which makes sense because you take it and you go down in the grooves of the teeth. If you want to, and actually we use it to feel soft spots in the tooth and that type of thing. A lot of times there's a stain in the groove of the tooth, and these cavities don't necessarily show up on x-ray as well because of how thick the enamel is. Another variable in that can be is how sharp or not sharp your explorer is.
Okay. So
there's a lot of variables in that. Now if we turn this around, this shows exactly what can happen on an undetected occlusal or biting surface cavity. So when it finally gets through the enamel, then it starts mushrooming out. This is a dentin, the second layer of the tooth, and that's the nerve where you don't want it to get to, obviously.
And then there's shear pain.
And then there's shear pain. So now we have, it's called a diagnodent. It's a laser cavity detector. Coolest thing, because what you do...
I feel like it's like your new toy.
It is my new toy. I love it. You take this little wand and you can run it over the surface of the tooth, and if there is no cavity, it won't read.
Okay.
If there is cavity, which it's not reading, it's plastic. But
and I don't want to do my teeth.
That's right. If there were cavity, this starts not only visually reading on here, but it will also beep. And the more cavity, the faster and the louder it beeps. So there's no...
How embarrassing at the same time.
It's great, though, because you don't even have to be looking. A patient can tell.
Right.
Now, a lot of times stain in a groove can mimic decay, so it works both ways. Sometimes you'll have stain and it won't read, so you know not to do a filling on that tooth. So it keeps you from overdiagnosing a cavity. On the flip side, a lot of times a tooth that has a little bitty spot in it, you won't catch with the explorer, and yet there'll be a big cavity down here. So it also keeps you from missing a cavity that could be very important for the health of the tooth, because doing a filling on a tooth like this is way less cost, way less time, and way less painful. So this is pain-free cavity detection. So it's such a great tool.
And it seems like a great investment for you, especially as a dentist.
Yes, because like I said, we take the x-rays, but this will read in places where the x-ray won't necessarily detect, and where your explorer sometimes could miss. Yeah.
So therefore, if they need to work more on their cavities, you can find it easily as well. So it benefits both.
Yeah, and the chart is like this. So if it's reading 0 to 10, it's healthy tooth structure. As it goes down a little bit where it's in the outer enamel, or this one, the inner enamel, but it's not through the enamel to the cavity, then a lot of times we know, okay, let's use some fluoride and let's use some sealers and try to protect the tooth from getting a cavity.
Wow, so just this alone can help determine a lot of things.
Exactly.
All right, Dr. Christy Leedy, thank you so much. Her new advancement in technology that she has at Abilene Dental. You can make your appointment at Abilene Dental today. Just call the number on your screen or head off to their offices of Buffalo Gap Road. Also, check them out on Facebook and Twitter. Just search Abilene Dental, and they also have a website right there. And don't forget, head to bigcountryhomepage.com/KTI for you to watch this and other segments you've seen on the show.